very unfortunate event that has happened in New South Wales. So New South Wales Health has just in the last couple of hours announced that we've had now our second death related to the AstraZeneca vaccine. Extremely unfortunate situation of a 52-year-old woman who had the vaccine a couple of weeks ago and has developed this extremely rare, but as in this case, sometimes quite serious clotting event. I will point out that it's only the second death with now over 3.6 million doses of this vaccine being given across Australia. I will point out that this remains an extremely rare event to get these serious clots, but when they happen, as we've seen in this case, it can have tragic circumstances. So my heart certainly goes out to the family and to all the friends and colleagues of this particular person. In terms of the AstraZeneca vaccination rollout, my colleague Commodore Young will talk to that more fully, but it remains an incredibly and extremely important part of our vaccine rollout. The AstraZeneca vaccine, with our large numbers of doses that are available here in Australia, up to, in recent weeks, 1 million doses available to Australians, is absolutely key in relation to us becoming safe from COVID as a population here in Australia, and that remains the case. As has happened every week, the TGA has released a more detailed report about events after vaccination, including this clotting event, and they now have found 7 extra cases during this week. And they've for the first time characterised these by Tier 1 and Tier 2 events, Tier 1 being the more severe forms of the disease, and so we now have 15 cases either confirmed or probable in that very serious clotting event. So again, 15 out of 3.6 million doses, so extremely rare. And in the second tier, the less serious effects, 33 confirmed or probable cases have met the definition. So these events remain of concern, and we are looking at them very closely. We learn from each of these, and including this unfortunate event in New South Wales. But the ATAGI group, our expert group on immunisation, has met again, has re-looked at that extra information, made that risk-benefit analysis as they did some weeks ago now in relation to AstraZeneca, have confirmed that for people over 50, that should be the vaccine of choice, and for under 50, the Pfizer vaccine currently is preferred. There is definitely a much lower risk of this event, these clotting events, the older one gets, and there is a definite cut point there at around the age of 50. So that's the news on vaccine. A second vaccine announcement today, the Royal Australian and New Zealand College of Obstetricians and Gynecologists, our experts on pregnancy, together with ATAGI, our expert group on immunisation, have issued new guidelines in relation to vaccination in pregnant women and those that are considering becoming pregnant. This is based on new information